It is only through this that we can implement a sustainable immunization program to recover the economy and restore normalcy in the lives of the Filipino people by 2023 through our Bayan spirit. In closing, I just wanted to emphasize the instruction of the President that we are walang iwanan. Maraming salamat po.
Thank you, Secretary Galvez. We will now hear from the Department of Health, Secretary Francisco Duque, for their presentation.
Thank you very much, Mr. Senate President. Magandang umaga po sa ating mga kagalang-galang na miyembro ng Senado, ang ating pong Vaccine Czar, Secretary Galvez, mga kasamahan sa ibang national government agencies, ang WHO Country Representative, si Dr. Abhiya Singha, partners and colleagues, I am pleased to present to you today the Department of Health's Strategic Plan for COVID-19 and Vaccination Plan. Tatalakay po natin ngayon ang vision, mission, goals, and objectives, pati na rin po operational details ng ating pong National Vaccine Deployment and Vaccination Plan. Kasama na rin po ang proseso para sa selection, procurement, distribution, at post-vaccination monitoring. Many of these aspects of our plan are already well underway, which will enable our vaccinations to commence by February of this year. Next slide. Wala pang slide. Oh, sorry. Can I just proceed, Mr. Senate President? Wala pa ko kasing yung slides ko po, hindi lumalabas.
It's okay. I have lifted the limit of 10 minutes to both of you.
Yes, sir. Yes, sir. Maraming salamat po.
May we have the slides, please? There is a technical problem. Are you about to fix it? While they're fixing it,
I can go ahead, Mr.
because
Senate
yeah,
President.
you can go ahead if you think that. Here we go. Go ahead.
Okay, maraming salamat po. Can we just go to the third slide? Okay, maraming salamat po. On the first matter of this presentation, the DOH Strategic Plan for COVID-19 Vaccination, malinaw po, next slide, malinaw po ang ating layunin to have safe, equitable, and cost-effective immunization for all Filipinos by 2023 or earlier when there is enough global supply before 2023. Ngunit gusto ko lang pong bigyan diin the many cogs of this plan are already set in motion. Our vaccine deployment will start in the first quarter this year at bibigyan po natin ng pagpapahalaga ang ating mga healthcare workers, frontliners, at vulnerable population. To achieve this, it is our mission to institutionalize an end-to-end immunization program for COVID-19, which will protect the public and reduce COVID-19 cases and deaths. The DOH objectives. Based on our current negotiations, we are on track to providing immunization services to 50 to 70 million Filipinos, provided, again, that the global supply of vaccines are sustained or even increased within this year. Kung kakayanin ng mga manufacturer na atin na enlist, best case scenario ay makakamit natin ang herd immunity po ngayong taon. Napaka-importante rin po ang pagpapalaksin confidence ng ating kapwa Pilipino. The effectivity of vaccines has been proven by science time and time again. And yet many of our kababayans have dwindling trust in vaccines. And so as we work to generate high demands for the availment of these novel vaccines, napaka-importante rin siguraduhin ang safety ng immunization program at bantayan at aksyonan ng maagap ang mga posibleng adverse events or adverse events of special interest. Maglalagay din tayo ng overarching governance, regulatory, financing, at performance accountability measures para isang sustainable at coordinated immunization program. Next slide po. Nakita po natin dito ang ating mga estratehiya para makamit ang ating pong mga objectives. Next slide, please. Una, para ma-establish ang employment and vaccination plan para sa isang whole of sector, whole of government, and whole of society implementation. And I will discuss more on this plan shortly. Nakapag-training na po tayo ng mga healthcare workers para ihanda sila sa implementation ng ating programa. Next, we hope to secure sufficient demand for the immunization program by closely coordinating with implementing units such as the local government units, other national government agencies, development partners, as well as the private sector. Even as we endeavor to ensure the vaccine we procure is safe and effective, we also face the reality that this is a novel product development. Hence, we are also laying down mechanisms to monitor and manage possible adverse reactions of the various COVID-19 vaccines. Magkakaroon po tayo ng COVID-19 National Regional Adverse Event Following Immunization Committees at isa pong centralized national AEFI surveillance system para sa isang coordinated vaccine safety, surveillance, and response. Maglalatag po tayo ng oversight mechanism para siguraduhin sang-ayon sa ating protocols ang buong end-to-end process ng vaccination deployment sa national, regional, and local levels sa tulong po ng ating mga vaccination operations center. Dito na po tayo dumako sa National Deployment and Vaccination Plan. This is the final item of my presentation. Ang National Deployment and Vaccination Plan ang siyang magiging end-to-end guide para sa mga implementers tulad ng ating mga LGUs. Nais ko lang magbigay ng karagdagan detalye sa ilang chapter na napag-usapan na po ni Secretary Galvez. Next slide. Gaya po ng naipresinta ni Secretary Galvez, meron po tayong streamlined scientific evaluation and selection process kung saan ang ating mga health experts ay nagbibigay ng rigorous, unbiased assessments, mga kandidatong bakuna gamit ang WHO criteria for COVID-19 vaccine prioritization at ang WHO target product profiles for COVID-19 vaccines para maibigay ang best possible vaccine para po sa sambayanang Pilipino. Meron na po tayong pirmadong agreement kasama ang AstraZeneca at ang private sector for the purchase of vaccines. At dagdag pa rito ay nasa advanced stage na rin po ng negosasyon kasama ang Novavax, Pfizer, and Johnson & Johnson. Tinutugma po natin ang ating deployment based sa prioritization list at scoping ng vaccine manufacturers para mabuo ang ating vaccination roadmap. The vaccine deployment and vaccination, however, is largely dependent of the global supply of vaccines available for the Philippines, the country's ability to access them, and on the application of manufacturers for emergency use authorization or EUA. Ito po, noong December 2020, nakapag-site visit na po tayo sa 3 third-party logistics providers para ma-assess ang kanilang cold storage at iba pang technical specification. Lalong-lalo na para sa mga bakunang nangangailangan ng negative temperature cold storage. The COVID-19 vaccines will be distributed to the 17 DOH Centers for Health Development across the country. At mula po roon, i-distribute po ang ating bakuna sa iba't ibang local government units, hospitals at iba pang identified health facilities na na-assess para sa pag-implementa ng vaccination program. To cater to these 3 cold temperature requirements, namely 2 degrees centigrade to 8 degrees centigrade. Yung pangalawa po, negative 70 to 80 degrees centigrade. Scenario-based planning was developed. Sa kasalukuyan, meron na po tayong kapasidad na accommodate ang 2 to 8 degrees centigrade. At ang negative 20 degrees centigrade, gamit po ang existing cold chain structures ng ating National Immunization Program. Distribution shall follow the pathway for the routine vaccines from the national cold storage up to the service delivery points, as what we have been doing for measles and oral polio virus vaccine. Nakikipag-usap pa rin po tayo sa third-party logistics providers para naman po sa mga vaccine na mas may komplikado pong pangailangan katulad ng negative 70 degrees centigrade storage requirement, lalo na po at di hamak na mas komplikado ang kinakailangan distribution mechanism para dito. Makikita po natin ang kabuuan ng distribution and deployment processes rito. Magkakaroon po tayo ng simulation activities, lalo-lalo na sa mga lugar na may matataas na kaso ng COVID-19. Magpapilot po tayo ng ating mga proseso para sa pag-profile, screening at registration gamit ng isang digital platform. Gagamitin po natin ang fixed post-vaccination strategy where we utilize our health facilities as vaccination sites gamit ang isang modelo na hawig sa ating mga COMELEC election poll sites. Ang latest count po natin ng ating vaccination sites ay aabot na po sa 4,512 fixed vaccination ng ating nationwide vaccination. Ito po ang master listing, micro-planning at mapping of vaccination sites and teams. Kasama ng Department of Information and Communications Technology, gagawa po tayo ng isang online platform para i-generate ang master list ng individual sa bawat LGU na kasama sa priority group. Napaka-importante rin po ang micro-planning kasama ng ating mga LGU para masigurado na hindi lamang tama ang ating pag-implementa, kundi angkop din po ito sa pangailangan ng ating mga kababayan sa iba't ibang lugar. We also have to finalize our mapping of vaccination sites and teams in order to ensure there are sufficient resources and to register the members of the vaccine teams. However, in order to properly scale up our human resources, we have to look into including other professionals in the vaccination workforce. Ang ating pong vaccination plan ay pangungunahan ng vaccination teams at AEFIs or AESI composite teams. Ito po yung magbabantay patungkol po sa mga adverse events na pwede po mangyari matapos ang bakunahan. Ang bawat vaccination team ay bubuin ng 6 na staff. 2 po, doktor or nurse or midwife para sa screening and assessment. 1 pong allied professional, volunteer para sa health education. 1 pong physician, nurse or midwife mula sa RHU para sa actual bakunahan. And 2 pong midwife, barangay or midwife or barangay health worker, health staff or volunteers from partner agencies para po sa documentation, recording, and vital signs taking. Sa kabilang dako naman po, ang bawat AEFI, AESI composite team ay bubuuin ng isang paramedic o di kaya nurse or midwife para monitoring. At isa naman po, surveillance officer or nurse or midwife events. Sisikapin ng ating bawat vaccination team na makapagbakuna ng 100 pasyente po sa isang araw. Ang pagbabakuna ay gaganapin sa mga fixed vaccination posts tulad po ng medical centers, hospitals, and infirmaries, rural health units, health facilities of other national government agencies, katulad po ng AFP hospitals and health facilities, ang BJMP, ang Bucor health facilities, and DepEd clinics at private clinics po. Ang ating pagbabakuna ay magkakaroon ng 5 bahagi. Ito po, mauuna sa registration. Isa is i-scan ang QR code na binigay noong pre-registration process at ipapasa ang mga documentary requirements, health declaration form at informed consent form. Pangalawa po, sa pre-vaccination health education at final consent, Sasailalim sa counseling ang mga babakunahan at magkakaroon po sila ng pagkakataon magtanong ukol sa bakuna at mga posibleng adverse effects. Dito rin ipapalabas ang isang video presentation ukol po sa bakuna. Pangatlo po, sa screening, kukunin ang medical history ng mga babakunahan at sasailalim po sa vaccination, sisiguraduhin na makumpleto ng pasyente ang checklist para mabakunahan. Pagkatapos, bibigyan po sila ng immunization card kung saan nakatala ang mga detalye ng pagbabakuna, halimbawa petsa ng pagbabakuna, pang-ilang dose, at petsa ng pangalawang dose. Ang panghuli po sa post-vaccination monitoring, surveillance, and recording, uobserbahan ang mga nabakunahan sa kung sakaling magkaroon ng adverse reactions upang masuri at magamot kaagaran. Graphically, ito po ang itsura. Pinapakita po rito ang magiging layout ng isang vaccination post sa lahat ng areas ng vaccination post. Ipapatupad natin ang pagsunod ng minimum public health standards such as physical distancing and crowd control measures, hand hygiene, and wearing of face masks and face shields. Prior to the vaccination, the vaccinee will be provided with a vaccination date and time schedule and a card with a QR code which he or she will bring to the vaccination post. Ito ay para masigurong maayos ang pagsasagawa ng vaccination at maiwasan ang congestion sa ating pong mga vaccination posts. Magtatalaga ng waiting area kung saan ang vaccinees ay mag-aabang para sa kanilang pagbabakuna. Each vaccinee will be assigned to a specific vaccination team and each teams depending on the needs of the area. In a stepwise approach, the vaccines or the vaccinee will proceed from the registration area, health education area, proceed to the screening area, and lastly, to the vaccination area. Hindi muna natin papauwiin ang mga nabakunahan dahil babantayan muna sila para sa adverse reaction sa loob ng 30 minutes hanggang 1 oras sa post-vaccination monitoring area. Nakalink din po ang ating vaccination site sa isang referral system facility upang mabilisan mabigyan ng atensyon medikal ang nabakunahan kung sakaling magkaroon ng matinding adverse reaction katulad ng anaphylactic shock. Once cleared, bibigyan po sila ng instructions ukol sa susunod nilang bakuna at ang mga adverse reactions na kinakailangan pong bantayan. Ng kaligtasan ng ating mga bakuna, we must be prepared to respond to adverse events. Kapag tayo po ay nakapagtala ng adverse events following immunization o kaya naman ng adverse event of special interest, agad po itong i-report at i-identify for seriousness at itatransmit sa provincial, sa regional, at sa national level epidemiology and surveillance units or ESUs. Kung ang naitalang AFI ay considered to be a minor one or not serious, detailed investigation and causality assessment will no longer be required. Para naman po sa serious AEFI, appropriate timely response including case management and a detailed investigation will be done to collect information necessary for causality assessment to confirm if the vaccine really caused the reaction or not within at least 48 hours. Sa tulong nga ng ating mga local government units, bubuin natin ang master list ng mga eligible populations. Ang mga pasyenteng ito ay magkakaroon ng sariling QR code at unique identifier na ipakikita sa araw ng pagbabakuna. Sa pamamagitan nito, ating pong i-monitor ang mga pasyente na nabakunahan ng first and second dose, ang kabuuan bilang ng mga nabakunahan at ang mga bakunang kanila pong natanggap. Meron din po tayong task group for demand generation sa jointly led by the Philippine Information Agency and the Department of Health. Sa kasalukuyan, meron tayong kampanya para palakasin ang demand generation sa pamamagitan ng communication and community engagement, social listening at crisis communication. And aside from ensuring that we have the necessary supply of vaccines, kailangan din po natin ng critical mass of informed advocates, mga doktor, mga nurses, mga midwives, national associations to help us drive our immunization program to success and eventually reach our goal of herd immunity. Needless to say, everyone has a stake in this, from the healthcare workers to the private sector, to the many Filipinos staying at home today. Binubuhos po namin ang aming mga sarili para maipatupad ito pong safe, equitable, at cost-effective na immunization program. Sa ngalan ng serbisyo para sa sambayan ng Pilipino, buong loob at pagpupursige kami magpapatuloy sa misyong ito na may pagkaunawa na hindi lamang kalusugan ng taong bayan ang nakasalalay, kundi ang kabutihan din ng mga susunod na henerasyon. Maraming salamat po, Mr. Senate President and the honorable members of the
Secretary Galvez and Secretary Duque, between whispers, Senator Lacson and I were whispering to each other. If your presentation is as good as your implementation, then we will have no problem at all. I hope we can do that. Anyway, as chair of the committee of the whole, I did not prepare any questions. I will leave it to my colleagues. I'm sure they will ask all the questions. I will just play the sniper role as usual. And then, but I have to give way before I acknowledge the first senator to be recognized, the privileged speaker. I have to give way to 5 questions from the public and the media. So let me start with asking, and any of the resource persons may answer. With the recent Pulse Asia survey of respondents want to be vaccinated if already there is a vaccine against COVID-19. How do you plan to succeed with the vaccination program? Pagkaganon?
Your Honors, we will be engaging in a massive social marketing campaign so that our people, knowing the previous very unfortunate experience with the dengue vaccine, we have learned, in fact, over the past years from 2018, where we had a very, very low vaccine confidence rate of about 32%. This has, however, improved over time, but more still needs to be done, Your Honor. And that's why we are working with the Philippine Information Agency, and we are producing our video production so that we can be able to show this to our of the vaccines that we will inoculate them with. And I think transparency is also very, very important in all of this, Mr. Chairman.
Therefore, a massive information campaign is your target, no?
Yes,
And
Your Honor.
I do suggest that you do that. Because right now in social media, you're being defeated by those presentations where they are being vaccinated and then they speak Chinese thereafter and all that stuff, di ba? Daming comedy nangyayari, nagkakaroon ng masamang harang yung thinking ng ating mga kababayan because of this social media presentations ng iba. So really, a massive information campaign.
Yes, sir.
Sabayan ninyo, pagka gano'n.
Opo.
Di ba?
We take
Senator
note, Mr.
Cayetano.
Chairman.
Senator Cayetano?
Tsaka, yun din pong kinakausap namin dito, Mr. Chairman, yung mga Philippine Medical Association, Philippine Nurses Association. We need these advocates to really help us to explain to the public about the safety and efficacy and the immunogenicity of the vaccines. And papaliwanag po natin yung proseso kung paano po ito pinili. Again, I go back to the key word, which is transparency. Yun po ang mahalaga na dapat po malaman ng taong bayan kung ano po yung proseso sa pagtukoy ng mga bakunang pinakaligtas at epektibo.
Yes, I hope you look at all angles, no? Because you know the one Filipino trait is that we are humorous. Ano, so medyo magandang angguluhan niyo rin yan.
Mr.
Sige ba,
President,
Senator
if I
Gaetan,
may
yes.
just quickly add, yung binanggit nyo, pagkatapos i-vaccinate, marunong na mag-Chinese. Okay na yun, that's a skill. Chinese is one of the third top used language in the world. Yung naging chonggo ka, yun yung mga importante ho yun. I mean, we laugh about it, di ba? Pero that's your point, Mr. President, hindi ba? Na talagang nauna sila. Yan ang nagsa-circulate talaga. Tama ho kayo dyan. And it really has to be addressed.
Mr.
All
Chair,
right.
if I may
The
add,
second question from the public, and of another survey that 91% of Filipinos are afraid to be infected. Kasi kung takot ka, you're looking for a possible escape or solution. So how would you reconcile the two results of two surveys? If you may, please.
tama po kayo, Senator. Kaya ito po ay pinag-aaralan po ng ating Health Promotions Bureau precisely to reconcile this rather confusing survey sometime in November. I think 66% po nagsasabi magpapabakuna, 32% of the 66% were saying that sigurado magpapabakuna sila. Yung pong 34% naman, sabi nila, hindi raw ho sila sigurado. And the remaining 34%, meron din ho doon na ayaw talaga magpabakuna kahit anong gawin daw. Yung iba naman, medyo hindi naman ho sigurado. So, naglumabas naman ng Pulse Asia, marami na ho mga naglalabas. Ang Okta Research naglabas din po na tila baga ang baba-baba po ng ang resulta ng survey. So ito po ay nakikita namin, magkakaroon po kami ng strategiya precisely to zero in on this apparently low vaccine confidence.
Public and the media. The second question is that you have been mentioning that the target is to have about 60 to 70% of Filipinos be vaccinated to achieve the so-called herd immunity. When do you think this can be achieved? When? Anong palagay nyo na about a timeline for a 60 to 70% herd immunity?
Ang herd immunity po is the ultimate goal. The ultimate goal of the President's policy directive is lahat ng Pilipino bakunahan daw. Po, yan po ang gusto ni Pangulong Duterte. Pero given nga po, meron po tayong supply limitations, within the year, we're hoping po na mga first quarter of this year, about February, Secretary Galvez can just elaborate on this after. So yun po, 60 to 70%, that's about mga 70 million Filipinos. Mag-umpisa po tayo itong February ng 2021 hanggang sa katapusan.
So, kailan ang target to achieve?
Sir.
Secretary Galvez.
Based on our target to have 148
50 to 70 million.
yes, sir. Based on the negotiations that we had with different 7 to 8 pharmaceutical companies, the best case scenario, depending on the supply and demand of the vaccine, if we can achieve the early deployments of this vaccine by semester, we might be able to have more or less 50 to 70. But if because of the restrictions on the supply chain, considering that the supply and demand, the global supply and demand is very, very acute in 2021, we might be having some sort of a shortfall, maybe on the second or first quarter of 2022.
First quarter of 2022.
Yes, sir.
Question in connection with that.
Anyway,
Senator
well,
Soto's question in connection with that.
Senator Villar, go ahead.
Yeah.
Senator Villar, go ahead.
There's a press release worldwide that young people below 16 years old will not be vaccinated. And so that is about 35% of Filipinos. So talagang ano lang, mga 60% lang talaga ang set ng iba-vaccinate. Kasi sabi sa Japan, all those below 16 years old will not be vaccinated. Kasi it has not been proven na pwede sa bata yung vaccine na yan. So talagang yun lang ang number of Filipinos that will be vaccinated because I look at the statistics, 35% are below 16 years old. So can you answer that?
Who wants to react? Yes, Dr.
Senate President, Honorable Soto, Senator Villa.
Please speak closer to the microphone.
Yeah, let me interject here on the question that was raised. We are in the process of evaluating the vaccines, and the current recommendation on not to vaccinate children under 16 pertains to the Pfizer BioNTech has granted EUA. WHO is looking at the Moderna and AstraZeneca vaccines, and our position is not yet released. So it depends on whether there will be other candidate vaccines which will be safe for use in children, but this is unknown at this point of time. The assumption was that a minimum of 60 to 70% herd immunity will be necessary to actually reduce the impact of the pandemic. So that is what we know, and we want to reiterate that there are a lot of things that are still unclear. So we are very closely working with manufacturers and with countries that are already implementing programs to better understand these issues and share them with countries. Thank you.
So, Dr. Abiyansi of the WHO, the World Health Organization, you're saying that the question of Senator Villar right now is unclear. The answer is unclear. It is not proven yet that this is not effective with the 16 and below.
It has not been tried out in children less than 16 years for two reasons. One was the fact that the incidence of the disease was very low in children, and so they were not prioritized. And also, of course, the manufacturers and all of the experts viewed the necessary to show that the vaccine is safe in adults before using it in children. So there'll be further research happening in the future when it will be clear whether children should be vaccinated or not. But at this point of time, we are not clear on that.
All right. Thank you. Now, okay, so that we can go on quickly. When you mentioned supply chain, let me go to the third question of the public and the media. Will be used by you to primarily consider or determine which vaccine will be procured by a government? Is it the efficacy? Is it the cost? Storage requirement? And look at the slide. When you
Mr. Chairman,
give us your reaction to this, Secretary Dugue.
Mr. Chairman, if I may, lahat po nung sinabi ninyo ay dapat i-considera. But the overarching consideration ultimately is ensuring vaccine safety and efficacy and quality. And also, of course, not to the same extent, the practicability of implementation. Kasi may mga iba po, mahirap, katulad po ng isang bakuna na nangangailangan ng negative 70 to negative 80 degrees centigrade. Cold storage temperature requirement. So ito po, iba pong strategiya ang gagamitin po rito. Dapat pagka dumating yung bakuna, diretso ka agad sa vaccination sites. Kasi kung hindi, masisira po yung bakuna at hindi na po pwedeng ibalik yun. So, kinakailangan po ang talagang maingat na pagpapaplano at pagsasakatuparan. Yun naman mga iba po ay meron na po tayong kapasidad dahil mahaba na din po ang naging karanasan ng inyo pong DOH na pagpapakuna, ilang dekada na po. Ang measles, DTP, ang ating po polio vaccines, ang hepatitis, lahat po. Ay meron naman po tayo na negative 20 degrees centigrade and also the positive 2 plus 8 degrees centigrade. So iba-ibang bakuna, iba-ibang pong mga kinakailangan.
All right. Now, may I go back to the WHO, please? Because the next question is the existing vaccines available now worldwide. Are they also effective against the new strain, the new so-called UK strain or South African strain?
Thank you, sir. The WHO made a statement on Friday evening based on findings that were released by Public Health England and researchers in the UK. They confirmed that the Pfizer-BioNTech vaccine appears to give adequate protection against the variant of concern 2020-12/01 variant, which is the UK variant. So the evidence now points to continued efficacy of the Pfizer-BioNTech vaccine for the UK variant. We also want to reiterate that many of the vaccines that are being used have multiple mechanisms of immunogenicity. Although the UK variant and the 501Y2 variant from South Africa both have mutations in 501YN location, there are other mutations that differentiate them from each other, but it appears that because of the multiple modes of immunogenicity in each individual vaccine, they will continue to offer protection. Of course, this is closely being followed up by multiple research organizations to confirm the observations that have been released by Public Health England and the researchers in the UK. And because of the time, it is still early to say that, but it appears that the vaccines are effective. Thank you, sir.
Does it have the same level of effectivity?
That
Effectiveness, I mean?
Yes, sir. That's what is currently known.
Currently known.
Yeah.
All right. All right. Thank you. Then one final question to the IATF. We are still on GCQ, right? Right.
Yes.
All right. Then therefore, what is the rule? What is your rule on the office's capacity? Is it still 50%?
As far as I recall, it's still 50%. That has been the IATF policy, Your Honor.
It's still 50%.
Yes, Your Honor.
That is the IATF rule.
Yes, Your Honor.
Yes, because there are government offices that are asking and are in a quandary, and other private offices. Like, for example, here in the Senate, the third and the fourth floor of the Senate building is cramped. We cannot be all here at the same time at present. So with the GCQ, you're saying it's 50%. All right. Thank you. Thank you for that. Now may we proceed to my colleagues. Let us start off with the speaker, the privileged speaker, Senator.
For the vaccine start. I noticed there are nuances or differences in your presentations. DOH has a set